Okay, Maddie, you're live.
All right. Hey, neighbors. Thanks so much for joining us. We are the Washington Progressive Party, and we are here today to welcome progressive candidate for Congress, Rebecca Parson. Here at Progressive Washington, leaning left of liberal, we put on a podcast show challenging the power of the two-party system and prioritizing the needs of our working class and our planet. With your support, we are building a national grassroots movement with local groups powerful enough to win progressive issue fights, elect progressive champions, transform our political system, and get big money out of politics. Thank you so much for joining us. Over to you, Jacob.
Hello. Today at Progressive Washington, we have Rebecca Parsons. Thank you for joining us, Rebecca. Would you please introduce yourself and tell us a little bit about your campaign?
Yeah, thanks for having me. My name is Rebecca Parson, and I'm a Democrat running for Congress in the 6th District, which is most of Tacoma and the Kitsap and Olympic Peninsulas. I am the only candidate in the race running on Medicare for All, a Green New Deal, a housing guarantee, and a jobs guarantee. I don't take any corporate PAC or lobbyist money, and my election is coming up this Tuesday, so very soon.
Excellent. Thank you for joining us. So after the primary, you're gonna go to the general, and in November you're gonna win your place, and you're gonna be able to use your position to make housing a human right. So tell us a little bit about that.
Yeah, housing is such a huge need that we have in the 6th District. In Tacoma, we have a lot of people who are homeless, sleeping on the streets or the parks. You know, the shelters are full. In other places in the district, like in Aberdeen, population 16,000, there are 1,000 homeless people. So when you have a town where 1 in 16 people are homeless, you know something's really wrong with the housing system. Then in Bremerton, people are struggling because of people moving from out of state and from Seattle, driving up the rental costs. People are being forced out of Bremerton. Port Angeles as well, very expensive. People can't afford to buy there. So there are even empty jobs there that they can't fill because people can't find a place to live. So housing is a huge issue in this district. And I have signed on to the National Homes Guarantee platform, which calls for national rent control and having the federal government invest billions of dollars into housing so that we can build and rehab housing across the country so that everybody has a home to live in. Sounds like a very lofty goal, ending homelessness. I'm particularly passionate about ending it here in the 6th District, but a national homes guarantee would benefit the entire country. And it is a lofty goal, but at the same time, it's very achievable because if we can afford to bail out corporations to the tune of trillions of dollars in the coronavirus bailout, we can definitely afford to pay for people to have a home. So that's what I support, and I'm really excited about a lot of measures in it, particularly national rent control. I'm a renter here in Tacoma. My rent's gone up a lot in the last few years. Even with Congress having provided us with so little while bailing out the corporations. I even paid my rent 6 days late this month, and it was a really stressful month for me. And so I think that we need to make sure housing is a human right for people. It is a human right, and really follow that up with policy and funding to make it happen.
Excellent. I live in Bremerton, and I really see the effects. You're starting to see more and more homeless people living out of cars, and the cost, compared to the jobs that you can get in the local area, it's very difficult. So also, I know that you're for Medicare for All. Day one, how do you take a system like ours that's purely capitalist, has a lot of costs that are inflated in medicine, in the hospital care? How do you turn our capitalist system into a Medicare for All system?
Well, one way we could do it is with an act that Representative Pramila Jayapal has put forward, which uses Medicare as a payment system and payment backstop to provide Medicare to everybody for the duration of this crisis. So it would pay anybody who doesn't have health insurance, it would pay for them to get health care, it would pay for people's premiums and deductibles who do have health care, and it would have the end result of making sure that everybody in the country during this pandemic has health care. You would think that in the middle of a pandemic, all Democrats would be leaping at the chance to make that happen, but sadly they're not. And what I think is really ingenious about this plan is not only does it provide healthcare to everybody in the district, everybody in the country through Medicare, But then it could also be a transition to Medicare for all. Everybody would get the chance to have a taste of what Medicare for all could look like, what it could be like to have healthcare with no deductibles, copays, or premiums, but being able to just go see the doctor when you're sick, something as simple as that without having to worry about going bankrupt. And then that could be a transition over to Medicare for all. I'm the only candidate in the race who supports Medicare for all. My opponent, the incumbent Democrat, Representative Derek Kilmer, opposes it, and he uses right-wing Republican myths to talk about why he opposes it. He recites facts that are simply not true. Medicare for all is the humane thing to do, the moral thing to do, but also the economically sound thing to do because it would save so much money. So to answer your question, I see us, this pandemic is the perfect time to ensure. We have to ensure that everybody has healthcare during a pandemic. If we want the numbers to start going down and stop continuing to climb up, here in Washington State, they're the highest they've ever been. How much longer is this going to last? Lawmakers need to give everybody healthcare. And so what I support is Pramila Jayapal's bill to use Medicare to give everybody healthcare during this pandemic. And then additionally, I support having that be a transition over to Medicare for all.
So when hopefully elected, how do you plan to push Medicare for all through Congress? Because I know it's quite rough with the bipartisan divide, but how do you plan to get conservatives or more moderate Democrats on your side to try and push legislation through so we can help all of these people who need healthcare?
Yeah, that's a good question. And sadly, I think that the corporate Democrats and the Republicans are really more like their own anti-universal healthcare party when it comes to this issue. And, we can try with facts, but I think a lot of them already know the facts. They just refuse to take them seriously. Their health insurance and pharma donors prevent them from really giving it a fair shot and taking it seriously and being willing to support it. And so I think what progressives have to do, what I would do as a member of Congress, is stand firm and not take this kind of continual weak Democratic approach of saying, you know what, I'm just going to decide before I even start negotiating, I'm going to decide what's actually achievable, what's actually reasonable, and then I'm going to just go with that. So they're basically negotiating with themselves before they even start. I think the best way to negotiate is to ask for what you actually want and stick firm to that and know that, I'm fighting for this because it would actually provide healthcare to all people, and just ignore all of their attacks about this being a purity test or not being reasonable. What's not reasonable is for people to die in the richest country on earth because they don't have healthcare. So what I would do and what I would, work with other progressives to do is just hold firm, hold our line, have enough of a voting bloc among us where we're voting in sync together for Medicare for all specifically, that we could start to actually wield some real power.
And I'm going to kind of go in with a question that links both your stance on Medicare for all and on affordable housing. But a lot of LGBTQ youth are kicked out of their houses or are on the streets homeless for one reason or another. And a lot of the time, drugs are very prominent on the streets. And so how do you deal with the drug problem in the United States while simultaneously allowing for affordable housing to happen? Because I know that affordable housing and Medicare for all are fantastic programs, but drugs are a problem that affects both housing and Medicare for all because we need programs to deal with those problems. So is there a way that you could combine that to help deal with the rising drug problems in the LGBT community as well as the other populations in the United States?
Yeah, one issue is I believe in a housing first policy, which is that housing should not be contingent on being clean and or sober. If somebody is an addict or an alcoholic and they're struggling, they haven't gotten clean and sober yet, they still have the same human right to housing as everybody else. So I believe in a housing first model. We should house everybody regardless of their, addiction status, whether they're clean and sober or not. I also believe in Medicare for all as a way to get everybody treatment who needs it. In my district, we have the top 2 counties in the entire state for opioid-related deaths. And one of them, Grace Harbor County, doesn't have a single treatment facility that takes Washington Apple Health, Medicaid. And so people who are low income and trying to get clean and sober just don't have an option there. Sometimes they're referred up to Port Angeles, but if they don't have a car, good luck getting there. So people die literally because they can't get treatment. And then even in Tacoma, where we do have treatment options for Medicaid, for example, detox, there's only one. So for the entire city of Tacoma that takes Medicaid, it's always full. And so people end up on the wait list for weeks and weeks and die waiting in line trying to get sober. So I support Medicare for All as a way to get everybody who needs it the treatment that they need. And then, like you said, LGBTQ plus youth are homeless. They're a disproportionate number of the homeless population, especially among homeless youth. And we need to invest more in youth shelters. Here in Tacoma, there's one youth shelter, but it's housed in a senior center that allows them to use it. And they can come in, I think, at 6 at night, and then they have to be gone at 6 in the morning. Nowhere for them to stay during the day. It's not, often it's full. I had a friend who stayed there. So it's better than nothing, but we really need our own dedicated youth shelter, and we do in other parts of the district as well. In Aberdeen, for example, there are 2 shelters, one for men, one for women. And if children or boys over the age of 12 aren't allowed to stay in the women's shelter. So if you're a mom who has a 13-year-old boy, there's nowhere for you to stay. And so we need a lot more funding in shelter and homeless shelters and permanent housing. And then also healthcare and Medicare for All specifically, I believe is really important for the LGBTQ plus community, especially trans people, because both for transition related healthcare, but then also for non-transition related healthcare. I met with a group of LGBTQ plus students in Port Angeles, and they described to me, a couple of them are trans, they described going to their local medical provider and being discriminated against, and that person not being willing to treat them just because they're trans. And especially in the rural parts of my district, there's a crisis with healthcare there. Healthcare facilities are having to close down. They need to focus on more profitable procedures to keep the doors open, but the profitable procedures aren't things that people in the area need at the highest degree. Treating a diabetic is going to be less profitable for less profitable for a medical facility than, for example, certain like cosmetic surgeries, whatever. So we really have a problem with our profit-driven healthcare system where, if you're trans, there may be that one place in your county that you can even go because you're in a rural area and there's only that one. And then if you go there, then you could be discriminated against because you're trans. And so with Medicare for All, we would remove profit from the healthcare system, and healthcare would be available based on the needs of the population, which would be extremely beneficial to trans people and the whole LGBTQ plus community.
And do you have any plan or any ideas of how we could kind of combat the Trump administration's act on not providing health care to trans people based on their chosen identity, or not chosen identity, but their actual identity as opposed to their assigned gender at birth?
It's terrible, and I think it's something that we need to put into law and make permanent, because trans people do not deserve to be treated like, just an afterthought at the whim of whoever happens to be president. We need to put these things into law so that all of our communities are permanently protected.
Rebecca, how do you define an economy where we can have good paying jobs?
It's a big issue in this district with jobs. In Tacoma, we have one of the largest ports in North America that provides some good jobs, especially longshoremen jobs. And then in a lot of the rest of the Tacoma, people are working low-wage service jobs with no benefits. And then in rural parts of the district, Kitsap County, the Olympic Peninsula, there used to be timber jobs that just aren't available anymore. That industry collapsed decades ago and nothing came to replace it. So for me, an economy where we have good family wage union jobs means that we have a federal jobs guarantee and we have federal jobs programs like we had during the Great Depression under FDR. And this district has a rich history of that. During the Great Depression, we had 7 civilian conservation corps camps on the Olympic Peninsula that provided jobs to people in the district who needed them during the worst of times during the Great Depression. And so that's the kind of thing I see us doing again, especially now during this pandemic where we are possibly entering another depression. We need to make sure that everybody has a job. And while this pandemic is happening and we're possibly going into a depression, the 2030 climate deadline is still looming. We're getting closer and closer to it. And to transition to 100% renewable energy economy, which we need to do, and I believe we need to do that by 2030. That's going to require a lot of jobs to move us over to research, construction, infrastructure, high-speed rail, all the jobs that go into transitioning a fossil fuel economy over to a renewable energy economy. That's going to create a lot of jobs, and I see that really benefiting my district and the entire state of Washington. And so that's what I see with how to define an economy like that, is that everybody has a good family wage union job in their community. And we don't leave rural areas behind when we talk about that. We make sure that if you live in a rural part of Washington state, you can get a good job where you are, and you don't have to move to the cities, the big cities, away from your family, away from where you grew up to get a good job. You can have a good life where you want to. I think you're muted, Jacob, or I can't hear you.
Go for it, Maddie, till he comes back in.
Absolutely. So, kind of backpacking off of the idea of kind of re-implementing some of FDR's policy, what policy exactly do you envision implementing, or do you have new jobs like you mentioned construction? Would that be something that vocational schooling would help kind of transition, or would that be something that specific job sites would be looking for? How would you implement some of those jobs?
Yeah, vocational training would definitely be a big part of it, especially if we're going to have a lot of new green construction, for example. That's new methods of construction, new technologies that people have to learn, new technology that needs to be developed and researched and manufactured. And so that would mean training for people to learn how to thrive in those jobs, learn the skills they need. And so that actually ties in with my education policy. Like Bernie Sanders, I stand for free public college and trade school, so that people can get the education they need to build the career and live the life that they want, pursue the career that they want, without going into tens or hundreds of thousands of dollars in debt. And one of the things I love about the policies I stand for is how they all work together. So let's say that you're in Tacoma or Bremerton or Port Angeles or Aberdeen. You can get a home where you live, and you can afford it. You're not going to get pushed out. You can get an education, you can get a job where you are, and you can live there and raise your family and live the life that you want to live where you are and thrive there, and not get left behind, not have to move, but really enjoy the life that you want to build right there.
You're still out there, Jacob. Still out. Maddie, go ahead and take a couple of more questions for her. You're muted, Maddie.
So you did mention your education policy, and Bernie Sanders also is advocating for free public college. How, I know this is kind of a general question that is asked a lot, but how exactly would you plan to pay for it? Because as much as these programs are phenomenal, and as much as we are already in debt, it shouldn't matter, but for some it does. So do you have a concrete way to pay for free public education for university students?
Yeah, one way is to enact a modest tax on Wall Street speculation. So every transaction that happens on Wall Street, put a small tax on it. This would actually have more than one benefit. One benefit is that it would help us raise money for some of these programs. Another is that it would discourage Wall Street speculation, which causes bubbles in our economy, and bubbles inevitably pop. And then it's regular people who get the brunt of the economic suffering after that happens. And so it would have the effect of raising us money and deterring that destructive speculation. Another thing we can do is, for example, my housing policy, put a tax on a vacancy tax. So if somebody owns an empty home and they don't live in it and they don't rent it out, then I believe they should need to pay a tax for the privilege of owning an empty home that somebody could be living in. Some other things with Medicare for All, for example, we would actually save a lot of money with that. People on average would be spending less on healthcare per year. As a country, would be spending less on healthcare, so we would save a lot of money there. Another thing we can do is end corporate tax loopholes. So a lot of companies base their headquarters in tax havens overseas so that they don't have to pay taxes. Companies like Microsoft, Walmart, Amazon, they don't pay federal corporate income taxes. And the result of that is that we actually subsidize their profit because they're able to pay their employees such a low wage. Minimum wage is $7, $8 in some states. Even here in Washington state, the minimum wage is still not livable. And because it's not livable, people are working full-time or more than full-time, and they still can't afford to just buy food. And so they need food stamps. And it's us who pay for those food stamps. So we're bailing out those corporations and giving them welfare so that they can continue to line their executives' pockets. So one thing we can do is, another additional thing we can do to raise money is have federal corporate income taxes. So those are the few of the different ways that we could pay for these programs. And I'm not sure if Jacob has his audio yet, but I do unfortunately have to hop off in a couple of minutes here. So
Can I ask one quick question?
Mm-hmm.
Yeah, this is Oz. I'm with Uphill Media. Thanks for coming on, Rebecca. I don't understand. Maybe you can because you're out with the constituency. But how in the world could anybody in that district support Kilmer when he's advocating to gut Social Security, signing on to Mitt Romney's plan, and plus the millions of dollars of corporate PAC money he takes from the health insurance and pharmaceutical? How could any Democrat, calling themselves a Democrat, support Kilmer in that respect? It boggles the mind. Can you explain that to me?
A lot of people don't know about it, and some people we just have to show them the proof. Look, here's the article. Here are the articles. Here are the FEC records. Here's his Open Secrets and page that shows he's the 11th most conservative Democrat in the House. And a lot of people just don't know the facts. They say, oh well, he has to be that conservative because the Olympic Peninsula is more conservative. Well, actually, our district has been Democratic for over half a century. And the Olympic Peninsula is not necessarily conservative; it's populist. That's why Grace Harbor went for Bernie and then for Trump. That's why it's the first time in 90 years that county went for a Republican president. They are tired of a political establishment that ignores them and leaves them behind. And many people thought that Trump was going to help them, and they found, unfortunately, that he was not. He's just like the rest of them, lining his friends' pockets, enriching himself. But what people want here is change, and for politicians who actually work for them and not their corporate donors. So, like you mentioned, Derek Kilmer has taken over $3 million from corporate PACs while calling himself a leader on getting money out of politics. I don't know how those two things cannot be true at the same time. And I'm just so fed up with politicians who say one thing and do another. Democrats who say the right thing and then they do the complete opposite. Like, he calls himself somebody who fights against Trump, but he votes for Trump's favorite policies. He voted to give DHS, Trump's secret police, $50 billion on July 15th, the same day that they were kidnapping protesters in unmarked vans in Portland, Oregon. He voted to fund ICE without sufficient protections for kids ripped away from their parents, voted for Trump's racist border wall, voted to extend the Patriot Act, and on like that. There's so many ways that he votes for Trump's agenda. And one of Trump and the Republicans' favorite things that they try to do is to cut Social Security. And as you mentioned, Representative Derek Kilmer on June 1st joined with Republicans to sign a letter calling for Mitt Romney's plan to gut Social Security behind closed doors. And Kilmer was the only Democrat in Washington state who signed that letter. And so people say, oh, well, you know, this district isn't Seattle. Yeah, it's not Seattle. We're our own district. We're a populous district that's been blue for over half a century. Kim Schreier represents a district that's much more conservative than ours. She's a Democrat. She didn't sign that letter. Why was Derek Kilmer the only Democrat in Washington state who signed this letter, especially in our district where 24% of the population is on Social Security? Out of all the congressional districts in Washington state, our district has the highest number of people on Social Security. I met a grandma in Tacoma when I was canvassing before the pandemic who receives $750 a month. Her rent is $650 a month. How is she supposed to live on $100 a month? Yet she makes it work somehow. I don't even know how she lives on only $100 a month for everything except her housing, but she does. And then Derek Kilmer signs on to this letter calling to cut her benefits even more. It's just cruel. And it's also completely illogical because if you cut Social Security benefits, by law, you're not allowed to spend that money on anything except Social Security. So it's not like you're going to save $1 billion from Social Security and then go plug it into our deficit. You're not allowed to. It's just pure cruelty for no reason. And Social Security is fully funded until 2035. And after that, it's funded at 90%. So yes, we need to raise more money from it, but it is not going bankrupt. That's a Republican lie. And Democrats who repeat it should know better. And so for me, I support protecting and expanding Social Security. One of the primary ways we do that is by scrapping the income tax so that people who are rich, billionaires, actually pay their fair share into Social Security, which they don't right now. Anybody watching this, if you make, let's say, $60,000 a year, you are paying a much, much greater percentage of your income into Social Security than Jeff Bezos. And that's not fair. He should pay his fair share into it, just as you are. And so what we do is scrap that cap, and then we can raise money to actually expand Social Security and not act like these Republicans and their Democratic enablers like Derek Kilmer calling for Social Security cuts. It's cruel, illogical, and totally pointless. It doesn't need to be done.
Thank you for letting me answer that question or ask that question. Maddie, do you want to carry us out? And I just have to say, I think Derek Kilmer should be running as a Republican. He's no Democrat. Anyway, thank you. You're muted, Maddie.
Thank you so much for joining us, Rebecca. And it was really great to talk to you and hear some of your beliefs, and best of luck in the primaries, and hopefully we'll see you in November.
Thanks so much. Bye.
All right, thanks, guys. Sorry about the sound there, everybody. Maddie, we got an Outgrowth song we're going. Is there anything else you want to say before I cut out?
Yeah. Thanks again to our guest, Rebecca Parson, and for all those watching, thanks for sticking around. In the description below the video on YouTube, you will find donation links to Uphill Media to keep the lights on, and social media links for the Washington Progressive Party to help push grassroots movements forward. Like, share, and subscribe to catch us next week at 2 p.m. Pacific Time, and tell us what you think. Let's get the conversation going.